Welcome to Breaking Bread, our conversation series here at Bread for the City. My name is Ashley Domm. I'm the Chief Development Officer at Bread for the City, and I will be moderating this important discussion today. We're going to talk about public benefits, but especially we're going to talk about budget cuts and benefit access and what might be at risk here in DC as we enter into our upcoming budget season. We'll be discussing potential for budget cuts. We'll be talking particularly about SNAP, Medicaid, housing assistance, and how such cuts or lack of further investment could impact DC's most vulnerable populations. Thank you all for being here today to listen in on this conversation. Please feel free to put questions in the chat as we go. We're going to have time at the end for question and answer. And I am happy to be joined by Allison Miles Lee, Managing Attorney at Bread for the City, focusing on public benefits and family law, and Erica Williams, the Executive Director of the DC Fiscal Policy Institute, specializing in fiscal policy and advocacy. So a fantastic conversation about to kick off here. Thank you both for being here, first of all. Before we jump in, I wonder if I can pass it over to each of you to tell us a little bit more about your work and its connection to public benefits here in DC as we start the conversation. Allison, can I kick it over to you first?
Sure. So as managing attorney at Bread for the City, we provide direct legal services to folks who are dealing with DHS, Department of Human Services, benefits issues. So we have a medical legal partnership at Bread. A lot of our referrals come through as medical patients that we're able to help when they have issues with their insurance being cut, their food stamps getting terminated, processing issues with their benefits. Our legal team is able to get involved to provide direct representation. And then we do some systemic advocacy around benefits issues as well.
Thank you so much. Erica, welcome.
Thank you. Thanks for having me. Hi, everybody. Erica Williams, she, her pronouns, Executive Director at the DC Fiscal Policy Institute. We are a nonprofit research and policy organization that's working to shape racially just tax budget and policy decisions so that we can realize an anti-racist, equitable future here in the district. And that work means we are engaging with lots of different coalitions and community partners, service providers, legal advocates across the district to try and advocate for the kinds of policies and programmatic changes that really can make sure that we're doing as much as we can to provide economic security for folks who are struggling to get by in the district and open up opportunity for folks and make sure that we have an inclusive economy where everybody can share in the gains and the vast prosperity that exists here. So happy to be here and to sadly talk about some tough times ahead of us.
Yeah, thank you both. And again, thank you both for being here. I want to mention right at the top of our discussion, it is March, it's Women's History Month. I love a female-driven panel this morning or this afternoon, now that it's noon. But I also would be remiss in honor of Women's History Month not to mention at the very top of our discussion that I'm thinking of women heads of household, women here in the district, and thinking about potential impacts to budget cuts and who could be impacted. I think single mothers in the district, female heads of household, these are clients that we see at Bread for the City. These are clients that Allison works with. And so throughout this discussion, I'll also be asking, who are these budget cuts going to hit? And I think it's especially poignant being Women's History Month that so many of the folks that we know are going to be impacted are going to be single mothers and female heads of households. But let's get right into it. Benefits like SNAP, Medicaid, and housing assistance, these are essential safety nets for the low-income families and individuals in DC, the people that Bread for the City serves. Before we can even dive into the upcoming DC budget season, which was the original, topic of this discussion, our communities are now being asked to contend with this other, elephant in the room, this potential $1 billion cut to DC's current year budget by the federal government. It's been all over the news. It's been a hot topic for advocates this week. Erica, if I could hand it over to you just to ask the question on so many people's minds as we kick off this conversation this afternoon. What is going on? What is happening down on Capitol Hill? And how is that potentially impacting our work here in DC?
Yeah, well, what's happening right now is truly unprecedented. For 20 years, Congress has allowed DC to spend its local dollars at current budget levels without disruption, even under continuing resolutions for federal appropriations. But what we're seeing um, Congress consider right now, this was passed by the House earlier this week, largely along partisan lines. Um, and is being considered by the Senate right now, is a continuing resolution through the end of the current fiscal year, so the end of September, that would hold federal spending at 2024 levels, fiscal year 2024 levels, and they've decided this time around to treat DC as a federal agency and require us to spend at FY24 levels, even though we're halfway through our fiscal year 2025 budget. So, and we're not talking about the federal side of things, we're actually talking about the local fund budget and the part of our budget that is paid for through DC raised tax dollars, right? So your income tax dollars, your sales tax dollars, your property tax dollars are being, basically cut off to for really no good reason. I mean, I think the only rationale behind this is to assert authority over DC's budget and to limit our budget autonomy. So this, if this passes, we will have to cut about $1 billion out of our budget within the last 6 months of the current fiscal year. That's a big deal.
Yeah.
For DC residents, and it's going to have a big impact. I think folks may know that human services, education, and public safety make up 2/3 of our budget. So it's not, these are going to be damaging cuts that hit a lot of things people care about, and that sort of will become like a precursor to other kinds of cuts that we're facing. We just had a revenue estimate where the CFO downgraded us by $1 billion over the next 3 years because of federal worker layoffs. And obviously we're going to get into it, but we have the threat of big cuts to federal programs like Medicaid, SNAP, and other things that really will be quite damaging for the district's budget as well, and for residents and businesses in our communities.
Yeah, so on top of this federal threat that's going on right now, we're also looking at, because of all of the other impacts with federal policies, you're saying that we're also already looking at budget cuts over the next few fiscal years.
Yeah, actually, and the last time we faced a revenue decline like the one the CFO is projecting was in 2020, when the pandemic caused unemployment to spike. So this is recession level, and in fact, he's projecting a recession for the district over the next several years. I think if we end up with $1 billion in cuts to local government spending, we could also see immediate layoffs that have ripple effects and also put pressure, increase unemployment, put pressure on our budget, and put downward pressure on our revenue. So I guess I should also note, in a place like the district, where unemployment is sort of overall high, Black unemployment is very high. It's about 10.7%. So has been at recession levels kind of chronically over decades. Cuts to the federal workforce, cuts to the local DC workforce are going to have a disproportionate impact on Black workers when there's already a lot of unemployment among Black workers in the district, because Black workers are more likely to be in the public sector than they are the private sector or the civilian force overall. So this is, in addition to kind of the disproportionate impact that we'll see on the benefit side and the cuts to programs and services, there's also a disproportionate impact for Black folks on the unemployment side.
No, and thank you for mentioning that. We're going to have a little bit of time later to talk more about ripple effects and, what kind of unforeseen or even very much seen and known ripple effects, or secondary or primary impacts we're going to be seeing. And we're going to have time again for your questions. So if you have questions about what's going on Capitol Hill right now, pop those into the chat so we can address those a little later on. We know there's so much going on. It can be really difficult to focus on where to put our attention each day, even sometimes each hour within the day. When we think about protecting our communities, protecting those who are going to be hit hardest by policy or spending changes. So for now, we're at least going to turn our attention back locally to DC to talk about Medicaid, SNAP, housing, our local benefits that we have for the residents here. We know Medicaid, for instance, is a bipartisan program, but it's under threat at the moment. We've heard about potential rollbacks on SNAP. Housing benefits has always been something that we pay attention to in the local budget as that comes out. Allison, turning it over to you. In your role working day in and day out with the clients here at Bread for the City, what are specific challenges that this client community could face when it comes to accessing public benefits? How, might those challenges also be impacted by potential budget rollbacks or, the cuts that we're thinking we could be facing with these types of budget challenges?
So we have a public benefits practice at Bread for the City to address the challenges that DC residents currently have in accessing and maintaining their benefits. So this is before we're even talking about any sort of cuts or rollbacks that may be happening. We work with folks, like I said, through our medical legal partnership, and also a lot of domestic violence survivor clients, family laws, other type of work that I do. And we do get a lot of referrals for single women who are recently leaving two parent households and who may find themselves applying for benefits for the first time as they struggle to in their new situation to support their children. And there are just the inherent challenges in accessing benefits now. A lot of it is because the Department of Human Services, DHS, has moved onto an online platform. They're discouraging people from going in person. They're not providing a lot of assistance for people who want to go in to apply for benefits. If folks are not tech savvy, if they don't have a smartphone or access to a computer, it can be really hard for them to apply for benefits, to recertify for benefits, to see their notices. The application can be really confusing to folks. There are glitches in the system. So you find that you can't advance to the next screen in an application and people may just give up. And there are other system glitches after you've submitted an application that end up denying people even though they've submitted everything they're supposed to submit. Frontline staff give incorrect information or lose things when people do go in person. And if people are managed to get connected to an organization like Bread for the City or another legal services organization, we can use our connections to try to informally resolve issues for people. And if need be, we can file a fair hearing request with the Office of Office of Administrative Hearings to get judicial determinations and get people back in their benefits. That whole process can be really overwhelming for people who are unrepresented. And so we're already in a situation now where it's difficult for people to get their benefits, maintain them. Any rollback of benefits or more complicated rules that may come out are just going to throw a wrench into the system that is already, frankly, teetering. When it comes to housing assistance, there's very limited subsidized housing assistance available in DC. DC Housing Authority, which is largely funded by the federal government, is chronically short-staffed. People have to wait for many, many years to get subsidized housing. Emergency Rental Assistance Program funds, or ERAP, the funds have completely run out. The application is shut down until October at the earliest. So those are emergency funds that are to help people stay in their housing when they've fallen behind. Help them pay off rent balances so that they don't get evicted. And for people that are now in the pipeline for ERAP, they have an application in before the cutoff, so they have a pending application. We're seeing people get wrongfully denied and having to challenge those decisions at the Office of Administrative Hearings as well. And then we're seeing issues with rapid rehousing terminations. So that's a program that's supposed to get people from homelessness to paying market rate rent in DC within a year. Obviously, in a city like DC, that's incredibly expensive. That's an unrealistic goal. Even if all the supports were provided that are supposed to be provided in the program, but we're seeing people get terminated without having had the opportunity to get up to the ability to pay market rate rent. I can talk more now, actually, about kind of what we predict could be budget cuts and how they would impact these different programs.
Yeah,
But yeah, just want
let's learn a little bit about the budget process first, and then I'm going to circle right back to you, Allison. But
perfect.
what I'm hearing from you is that, I think it's worth mentioning that Brentford the City is about to celebrate its 51st year in existence. There were problems before this federal administration in terms of people in DC being able to access their benefits. The first full-time legal clinic work that we did was benefits related for exactly all of the reasons that you're laying out. So essentially you're letting us know that even before we might have to cut even more funding from the DC budget, people are already experiencing barriers. Even when these programs are fully funded, are you seeing that people experience, certain barriers to being able to access their benefits?
Right, absolutely.
Yeah, so we'll talk a little bit about that. I want to hop over to Erica real quick. Just if you could, for a moment, walk us through DC's budget process. For anyone who's new to the DC budget process, for anyone who's been newly activated by what's going on federally, welcome. We are happy to have you with us. But I think it gives us a moment to just learn a little bit more about where are we in the process, how does the DC budget process work, and what's concerning you the most as we enter into the next fiscal year's budget process as we go through this season?
Sure, yeah. So every year we have sort of kicking off in February, we have the opportunity as folks who live here in the district to start weighing in on what's happening in our programs and with our programs and services, and in what we want to see happen in the coming fiscal year. So our fiscal years, but just so folks know, run from October 1 through September 30th, aligned with the federal government because they have, as you know, to finalize our budget plan, our spending plan, we need congressional approval, whether that's kind of implicit by them not weighing in or more explicit. So that happens every year, and we tend to kind of kick off the process of our performance oversight hearings in the early part of the year, where we get to say what we see happening with the budget, and specific agencies and programs where we can lift up some of the challenges that Allison was just raising to council members and to agency staff to get questions answered, to see what they're thinking about doing about some of the challenges, to make sure that they understand the challenges that residents are facing trying to access different kinds of benefits and programs. Then we move into more fully the budget planning process, and we get a final revenue estimate from the chief financial officer at the end of February. The mayor uses that to devise her budget proposal, which we had expected this year would come out on April 2nd, but I think given everything that's happening, our timelines may shift. But you typically get the budget proposal that kicks off budget oversight hearings. Again, it's an opportunity to weigh in with agencies about where we want to see things go in the year ahead. You have a committee of the whole budget hearing that is actually a very important opportunity for residents, for businesses, for folks who care to weigh in on what they want the council to prioritize in the next year's budget. Then committees, the council has various committees covering different parts of the budget. They do their own work to kind of figure out what can change, what needs to change within their part of the budget, within their area of the budget, whether it's housing or health or education, what have you. council then comes together a work session. They do a little bit of negotiating among each other, with each other, and like a little bit of horse trading. In between those two things, there's an opportunity to kind of influence what ends up in committee reports and what things they try and achieve through the council work session. And then we start to have our budget votes, right? So the end of May, we would expect a first vote on the two bills that make up our budget. So the money bill and the sort of technical policy bill. We should, normally we would be done by kind of the end of June with final budget votes. And then that budget would go to Congress for congressional review. After it went to the mayor, it would go to Congress for congressional review. So that's sort of the process. I think right now we're this was the case before, and it's even more the case now, that the mayor and the council are kind of at an important crossroads for thinking about how we raise and allocate resources through our budget. The federal threats that we're talking about here to talk about today are really gonna hit hard at a lot of folks in the district, disproportionately Black and Brown residents who bear the brunt of economic hardship in the district because of a long history of racism and economic exclusion. And so I think we need, we're in a moment where we're going to see if district leaders are ready to be proactive and do everything they can to mitigate the harms that are coming, or if they're going to be sort of passive actors in this moment and just sit back and sort of wait it all out. And I think you can see conversations happening that seem to show that some of our leaders may be willing to do more proactive things, and others are trying to be kind of small in this moment and just fly under the radar. And I think that that's really a call to all of us, that it's going to take a lot of effort and a lot of our time and energy to really get them to meet the moment and to be proactive and to do
Exactly. That
everything they
whole
can.
question of political will, right? And
Yeah.
I think everybody here who called in this afternoon will be talking a little bit later on about how you can get involved, but exactly correct. Everybody has to have some sort of this is a moment for us all to really get involved and pick the part of the pie that you want to go after. I think it's important to note when you walked us through the budget process, and thank you so much for that. Most cities don't have to submit their budgets to Congress. I don't think any other city has to. It's because we are a federal district, but it's important to note that we aren't a federal agency. And so the fact that the Congress is getting involved in a really unprecedented way in our budget like this is it's not normal. I think it's good just to say, this isn't normal. Erica, from a policy perspective, after kind of breaking down, how the budget works, you had said earlier that 2/3 of the DC budget goes to safety, education, and benefits. We're here today talking about benefits. How does the decisions that policymakers are making now for the DC budget, how does that impact the future of public benefits? What are those types of challenges that might come in the future, or impacts in the future, by conversations that we're having now about what gets put in the budget now?
Let me come off mute.
Yeah, I was gonna say the mute button. It still
Every
gets us
time.
every
Still
time.
gets me. It's, there's a big impact of like the decisions we make now on what happens in the future. We are seeing even before the current federal threats came into play with this continuing resolution, we were hearing that we were going to see efforts to sort of pare back the budget. And, with the mayor's folks talking about looking for places where, they just didn't think programs were working anymore, or where they felt like programs were growing faster than the overall growth in our budget year to year. And I think there's a lot of talk these days about the budget be growing out of control and sort of this narrative that we need to rein it in. Unfortunately, that narrative is not actually rooted in the data or evidence of what's actually happening. When we've looked at spending over the last couple decades for the district as a share of the economy, which is important because we want our spending to actually keep up with the growth in our spending to keep up with growth in the economy. When you have more people, when you have economic growth, you need to be able to provide the kinds of goods and services that everybody wants and needs in the district, not just for folks who are low income, but for everybody, right? And so you should expect spending to keep pace with growth in the economy. That is what has happened over the last couple of decades, but is starting to not be the case because we are seeing revenue as a share of the economy decline in the coming years. And that means that we won't be able to keep up with meeting people's needs. I think when it comes to our public programs, there's a lot of, people look at some of the problems that Allison raised around agencies not being able to function properly, programs not being administered the way they're supposed to. And the inclination is that, oh, these don't work, we should get rid of them, rather than what are the investments we need to make to actually have these programs function. I think a lot of people think about this idea of efficiency, and we're getting a lot of conversation around that right now with Doge and everything, that is about cutting programs and services when they're not working, efficiencies that are geared toward effectiveness may actually require us to spend more money. When we are understaffed in our agencies, we don't have enough caseworkers, for example, to connect people who are homeless and just got access to a voucher to an actual place to live. That's a breakdown in our system. And what we need are more people, more caseworkers engaged, and that will cost more money. So anyway, I think some of these conversations set us up a little bit for failure in terms of being able to do the things that district residents really want us to be doing. And we have some polling out there that shows that DC residents want the mayor to lean into the kinds of spending and investments that actually reduce economic hardship, not move away from it.
And the budget of any given area, right? The budget of a country, the budget of a city, your own household budget, that's showing things that people value. And I think bringing up, that kind of polling is perfectly on point, because if these are our elected representatives, these are the folks who are meant to be carrying out the things that people here in Washington, D.C. value, then we want to see that in the budget. We want to see that, over there reflected in the budget. Allison, I want to go back over to your comments about impact. If there are certain cuts in the DC budget, what will that look like? But I have, kind of a two-part question in a way. We have been seeing everything that's been going on in terms of economic security in our region with some of the federal policies. And this is where federal policies and local impact don't exist in a vacuum. They really, impact each other. Are we expecting a rise given the widespread economic impacts that we're seeing because of layoffs and firings, the impact to the federal workforce? Do you think that there will be all sorts of folks here in DC, in addition to the clients that Bread for the City sees, who will be impacted by additional then cuts to public benefits? And what do you think those impacts will look like?
Yeah, I mean, if people are laid off, people may themselves now qualify for the same public benefits that our clients get, particularly folks who don't qualify for unemployment benefits, and which is a not insignificant, number of people. And Yeah, and kind of thinking about this is really dark stuff, right? So I was trying to think through like what are the literal potential impacts, like what could happen to our clients' benefits. So bear with me while I talk
Yeah,
through.
everybody get ready for some worst case scenario
Um,
and
yes,
think about the
I'm not
happy
trying.
thing you're gonna do after this
Right.
conversation to move forward.
So not trying to alarm anyone, but this is an alarming time. And it was helpful for me at least to think through like where is the like honestly low-hanging fruit that we should be most worried about. And then up to the worst case scenario. And so obviously, you know, families, our clients with low incomes rely on benefits like food stamps, SNAP, TANF, the temporary assistance for needy families, and Medicaid, and Alliance, which is a DC funded health insurance program. Medicaid, for example, is a really critical support for families. The federal government sets a floor for Medicaid. So it says if you are a state, or in our case, a city that's getting Medicaid funding, you have to provide this minimum amount of coverage, and minimum um, income eligibility requirements. DC has historically gone above and beyond and used local funding to provide more than what the federal government pays for. For example, DC has expanded Medicaid to extend it to single adults without children. That's something that a lot of states have opted not to do. And so that is something DC has done. DC has also increased the income limit for Medicaid. For most people, there's Medicaid coverage if you earn up to 210% of the federal poverty line, which is about $2,700 a month for one person. The rest of the country, it's just 138% of the federal poverty line. This is vital in a really expensive city like DC to be able to pay for Medicaid for folks that have higher incomes than the 138%. For qualified Medicare beneficiary program, which is a critical program that pays for wraparound insurance for Medicare recipients. So those are people who are on SSDI or over 65 years old who get Medicare. If they did not have QMB, they would have to pay monthly premiums. They'd have to pay for co-pays, and they'd have to pay for prescriptions on their own, which is something out of pocket that low-income Medicare recipients would not be able to do. QMB Federal funding provides QMB for people up to 100% of the federal poverty line, which is like about $1,200 a month for a single person. DC provides it for up to 300% of their federal poverty line. So you can have a much higher income in DC, although it's still low income, right? If you're at 300% of the federal poverty line. But without QMB, you know, our clients really are not able to pay for their medical costs. We had at Bread for the City a patient whose QMB lapsed. We were helping her get it back on. In the meantime, she had to go pick up what she calls her blood sugar medication for diabetes. And she was told it would cost her over $1,000 out of pocket just to get that. And so she's earning above 100% of the federal poverty line with her retirement benefits and a part-time job, but she certainly does not have $1,000 to spend.
And does that 300% that DC will cover, is that to make up for the fact that cost of living in DC is higher than another place across the country, for instance? Because the federal poverty line is across all 50 states and territories. So I'm assuming that that 300% has something to do with the fact that cost of living here is high.
Yeah, absolutely. Yes. And so yeah, the federal attacks on Medicaid or on DC's budget, like we're talking about the $1.1 billion that could disappear from DC's budget, is going to directly impact DC Medicaid. So it's going to force DC to consider rolling back some of those expansions that I talked about, maybe going back down to the minimum levels required by Medicaid law. And then DC may also have to consider sacrificing certain benefits that are optional under the Medicaid Act. So that includes dental, vision, home and community-based services, which are home health aides that go out to low-income individuals living with significant disabilities. It's intended to keep people in their homes, to not have to go into institutionalized care. So those things that are optional, but DC has opted to provide, those
If
could
they
be
don't have
difficult
the
choices
money to
that DC
provide
has to make.
those might be on the chopping block.
Exactly. And this is all at the expense of low-income, older DC residents. And then we're also concerned that the federal government could reduce the percentage that it contributes to DC Medicaid cost, which is called the FMAP, or the Federal Medicaid Assistance Percentage. So DC, it's basically like a matching. So federal government pays for 70% of Medicaid costs, DC pays for 30%. That's a high FMAP for a reason. So the 70% is higher than most states get for Medicaid as a percentage of their Medicaid costs, because DC is not a state. So DC, being a district, a city, does not have the same financial means that other states do to make up the difference to ensure that its residents are protected. In particular, DC, not being a state, cannot tax non-residents for income earned in DC. And Erica, there may be other reasons. I don't know all of the ins and outs of this. That's the big one.
That's the
Yeah,
big
I am
one.
curious, Erica, if so much of what we're talking about today, these threats to funding, initially really thinking about the DC budget and how the DC policymakers put that budget together, but now thinking more and more and more about the federal threats, how much are the challenges we're talking about unique to DC because we're a federal district? How many of those challenges would go away if we became a state, for instance? Versus how much are all states across the country, even though they do have that status as being a state, also being challenged by what's happening right now?
Yeah, that's a great question. So there are some things that are unique to us and some things that aren't. I mean, I think the threat of changes to the federal match for Medicaid, you know, Congress is looking at that, congressional Republicans are looking at that for the entire country, not just DC, but they may balk in the end, right? There may be a lot of Congress members who say, actually, I can't force those kinds of cuts on my own constituents, my own state, my own constituents, because that's like the death knell for me. But they can do it to DC no matter what, partly because we don't have representation in Congress, and so we don't have anyone to kind of protect us and watch our backs there, or voting representation, I should say.
Exactly. Yeah.
And partly because, as Allison mentioned, the higher matching rate for DC is laid out in the National Revitalization Act, and that is the law that was put into effect after the control board that sort of said, hey, look, DC has been saddled with all of these expenses that other states are responsible for, but doesn't have full taxing authority of a state because, as Allison mentioned, we are unable to tax the incomes of non-residents. So, I mean, and for DC, that's a big deal. If we were taxing the income earned here by non-residents the same way we tax income of residents, which any other state would do, and other states do this as a matter of course, that would be more than $3 billion additional dollars we would bring in every year for our communities and our economy. And so we would be able to potentially afford a 50% match rate rather than a 70% match rate, but we're not going to be able to because of that limit on us. And I just, I would also say, DC is unique in sort of the level of inequality here.
Yes.
That is also part of why under current Medicaid rules, we would have a lower match rate if it weren't for that intervention in the Revitalization Act. So we have per capita
We have
or on
a couple
average high
different things hitting
incomes.
us at the same time.
Right, we have high incomes, but we have high poverty. So
The
there's a
the wealth
big
gap
gap.
is really, really
It's huge.
stark here, and taxation without representation has never felt so harmful as maybe it has.
Very real.
More recently, I want to talk a little bit about SNAP. The DC area food bank releases their annual hunger report. We, of course, at Bread for the City look at that really closely every year. And hunger was already on the rise before we started seeing more harmful federal policies coming out in January. What was really interesting from that report this last year is that the areas where hunger is on the rise in DC is really surprising, that it's not only in low income brackets, but also the widening gaps for people who are food insecure here in the district are coming really from those traditional middle class brackets, housing households that have an income around $100,000 to $120,000 annually are really seeing increasing rises in food insecurity. I'm curious what either of you have thoughts on just DC's report card. If we were to put together kind of a report card here in DC, where are we struggling? I think hunger for me and food insecurity is always something we take a look at. DC's continually, it appears, in a housing crisis. I know that we have the worst numbers when it comes to senior food insecurity, for instance. What are the areas of DC's report card that are concerning each of you? What are kind of the areas of that same kind of analysis where you feel like we have a pretty good handle on certain areas, but you might be concerned that new federal policies might shake a solid foundation there? Where are we the most concerned here with DC's report card?
So I can just start in defending DHS, which I rarely do. But again, like DC has made choices to expand SNAP eligibility and make it easier for people to maintain their benefits. Those choices could go away. So that's like the positive is they have done expansions. And the bad thing is what's happening now. DC has expanded eligibility to 200% of federal poverty line for SNAP. Elsewhere in the country, it's 130%. So if DC felt forced to reduce local funding for SNAP, it would have the same 130% cap that's across the country, which is going to impact a lot of low-income families. Because even at 200%, that is, like you said, Ashley, those are not the middle income families. That's still very low income. And then DC has been applying every year for what's called the ABOD waiver, which is the able-bodied adult without dependents work requirement. So there is a federal work requirement for food stamps. DC, based on its high level of unemployment, qualifies for a waiver from that work requirement, and they have been diligently submitting waiver requests every year. They've already submitted it for this coming year. I believe it's been approved. The federal government could take away the waiver entirely, or it could do what Trump tried to do in his first term, which was expand how DC has to look at the unemployment rate and look at the entire DMV area rather than looking at DC itself. So if we were to look at the entire DMV area, we would not qualify for the ABOD waiver because obviously the outskirts of DC have higher employment rates. And the ABOD, this work requirement is really concerning to advocates because we don't see it as an actual effort to get people working. People are not they're not working on purpose because they'd rather be on food stamps, right? People are struggling with a whole bunch of mental illness, physical illness, difficulty applying for Social Security disability benefits that they may qualify for. Even just being able to gather documentation to show why they should be exempt from a work requirement is going to be a really hard lift for people. Like I was explaining at the top, anytime you have to report things, submit verifications to DHS, there's always the risk that they're not going to get processed correctly or they're going to get lost. So we really see the SNAP work requirements and potential Medicaid work requirements that you may all have heard are also potentially on the table from the federal government. Those are really concerning. So I think, DC doesn't get an A, but DC maybe gets like a C plus, B minus.
Yeah, we got a passing grade.
Right. And I think we just need to fight to keep that going forward.
Yeah, and Erica, you all at the DC Fiscal Policy Institute, you're looking at these hard numbers, every day and projecting out, where things could shift based on different policies. What are you seeing if you were to grade the district, if you were to provide a report card?
It's, I think I would agree with Allison. It's hard to give a grade, but I would agree with Allison
Doesn't
that
have to be a grade, just more what would be on there? What would be?
like we are a place where we've done good things. We've tried to make progress, and push against what are really deep-seated sort of forces that have resulted in really extreme inequality here in the district. So we have 1 in 3 Black children living below the poverty line and 1 in 4 Black people. We have the highest Black to white unemployment ratio in the nation, 4.5 to 1.
Mhm.
Um, Income for white households in DC is 2.5 times, almost 3 times higher than for Black households. Everybody knows the stat about 81 times white
Yeah, the
households
wealth
having 81
number.
times the wealth.
Mhm.
We also know that there's something like 1,500 households in the district that hold 46% of all the DC, all of DC's wealth, to the tune of $183 billion, and we're barely taxing that. So we have just these extreme levels of inequality. And so even as we're doing good things, and we have gone farther than others in terms of food assistance, housing assistance, income supports, and so forth. Even though we're doing more than others, the magnitude of the sort of trends we're grappling with and the inequalities we're grappling with just requires that we really dig deeper. And it also requires that we stay on a steady course and not have all this backtracking. So even before these federal threats, we've seen over the last budget cycle, a couple of budget cycles, sort of, DC drawing back from some of these investments. Like we have a strategic plan to end chronic homelessness. We're not following it. And if we were, we would be making headway. So, I think that sort of bodes poorly for us when we're thinking about things like, are we going to see work requirements in Medicaid that cause 159,000 adults in the district to lose health coverage? Are we going to see that FMAP, that federal matching rate for Medicaid go down? Are we going to see a cost shift to states with SNAP, right, where we have to pick up a share of the cost of food assistance in order to maintain the level we have now? And can we afford that? Those are all going to be big questions. And if we want to do our best to not backtrack, we are going to have to put more local resources toward the kinds of tools we have on the table for combating those forces of inequity.
And I think that goes back to what are our values as a city and as a community. It's a really great segue to talking a little bit more positively about how people can impact change. So deep breath. We just asked you to take a break from your daily doom scrolling and spend your lunch with us, only to then hear of some of the worst scenarios that could be happening both locally and federally. I think this is a great time to transition over to how do people get involved? What should average, residents here in DC do? What should community organizations like Bread for the City do? How can we advocate for these things? I think what we heard this afternoon is that yes, there are a lot of things to be concerned about. If we could hold up public benefits and public supports for low-income folks here in the district, and especially what you were speaking on, Erica, about the wealth gap. If people are coming to this conversation with a desire to fix these challenges, to fix these issues, if that's our values, how do we get involved? How do we get involved in the local budgetary process? How can organizations like Bread for the City be involved? And then how could we even start impacting something that feels so big as the federal challenges?
Well, I can start. I mean, I think, making your voice heard is a big deal. I mean, I think people maybe take for granted that, or maybe take for granted is the wrong word, but maybe don't think that they if they make a call, that it's going to matter. But I think right now, like every voice we add to the choir about both on the federal and local side helps us advance an agenda that's going to be mitigating harm, that's going to help our most vulnerable residents, going to keep us from backtracking. So don't doubt that your voice matters and make it heard. You can do that by testifying. And groups like ours and others are like Fair Budget Coalition are ready to help folks engage that process and put together testimonies. Share with people and on social media to the extent that you're on there. If you're willing, go down and have conversations with council members and their staff. They do care about hearing from people. Um, you can join the Just Recovery DC campaign if you're interested in seeing us raise revenue to deal with some of the problems and to mitigate some of the harms that are coming. That's going to be really important. And I guess I would make a pitch to folks who are doing well here in the district and in DC's economy. If you have a higher income or you have wealth, it's actually really important that council hears from you about what you're willing to pitch in for the good of our larger community here in DC. I think there's often a view that folks who have a lot won't want to be here or won't want to stay and don't want to contribute. And I don't actually think that's true based on polling that we've done and conversations we've had with people of means who actually want to see all residents here in the district be able to live to their fullest and thrive and succeed. So those would be my pitches to everybody.
And we'll be sharing a fair amount of resources based on what, Erica just said to everybody here. We'll be able to send out some links and things so that everybody has access to that. Allison, I feel like a week doesn't go by without one of the lawyers from Bread for the City testifying or going down to the council office or circulating a letter about something that could be done differently or better on behalf of your clients. What types of activities are you all involved in, or you would ask people to help you with so that we could turn the tide a little bit with some of the things we're worried about?
Yeah, all the stuff that you just said, Ashley, that Erica said. So Bread for the City, we are testifying before DC Council. We were part of a group that went to Congress to lobby them about the need to keep the 70% FMAP for Medicaid. So meeting with congressional leaders. I think for folks, donate to places like Bread for the City, where we're on the ground doing this work. DCFPI, other organizations that are doing this. And yeah, I really think it's important to get the word out. Like, just for example, with that $1.1 billion that basically could get stolen from DC, that happened on Saturday it came out. I didn't even hear about it until Tuesday. And I read the Washington Post, every day. There was no media coverage about it. Until today on the Metro front page of the Metro section in DC, there were some alarming articles about it. But if you didn't live in DC, or if you're not really following these things, you might not even know that it's happening. And I think people would be appalled across the nation if they understood what is happening at no benefit to the federal government, right? So I've been seeing people on Facebook, writing about it. And I think that's really important.
Yeah, making sure your loved ones in states that have voting members of Congress have a sense of what's going on, because without that information, a lot of people might think that the $1 billion that's being cut is their tax money, for instance, their federal taxes, and not, local DC income, for instance. I think that was a shock to a lot of people, and misinformation is something that we always have to grapple with, and making sure that there are people that are able to educate and just get that information out there. I'm going to thank you both first for being here and for going through all of the questions that I have. I feel like I could do a whole other hour picking your brains about a lot of the things that are happening here. Again, I know so much of this is just coming at us so quickly every day. It's like drinking from a fire hose. That is by design. And so for everybody joining the call, I think it's important to find a handful of areas of concern that you want to dig into, that you really want to work hard at. It really takes a village. It takes all of us. There are so many threats that we are fielding at the moment. And so figuring out what you value the most and how you can really be a spokesperson or be an advocate for that area is always going to be the biggest thing that I will share. We have a couple questions from our participants here. And so I'm going to read through a couple of these, knowing that I'm going to try to keep us kind of brief because we're getting close to 1 o'clock. So one question that was submitted is, there has been conversation from the city that even if Medicaid is not federally touched, the city will still consider chopping some of these benefits. Is that conversation that you all have heard? Is that right? Is Medicaid potentially something that the district is looking to cut?
I think so. I saw again in that article in the paper that DHS would likely have to cut $28 million if this 1.1 budget shortfall happens. I can't imagine that that couldn't include some Medicaid costs, in addition to things like food stamps. But Medicaid is not, like we were saying, it's not fully paid for by the federal government. There's a cost sharing here with DC, and then these added programming that DC has added on and is paying for could all be at risk.
I would just add, I think the alliance, the healthcare alliance, is definitely on the list for the mayor of things to cut that she thinks are growing too quickly. So
That's something for everybody to keep a watchful eye on. Last question that I'll pose before we wrap up here. Do we feel, or do you think that the local DC government has an obligation or a commitment via the budget, via what they decide to value and put in the budget, to help those who are being harmed by these federal politics? How is the reduction of the federal workforce, for instance, something that's on the minds of our local DC policymakers? And should they be stepping in and changing some local policies to continue to support potential economic, widespread economic impacts? Any thoughts on that one?
That might be an Ashley question.
Is it it's like, is it a question for
Above my pay grade at Bread for the City.
in terms of the local DC government, there are, when I think about this particular question, I think a lot about what both of you have already shared this afternoon, that even before this, the federal workforce was reduced, we were already really challenged by getting the things that we value passed through the DC Council and the mayor's office, making sure that we're supporting those who are already being hit hard by economic impacts. To Erica's fantastic points and statistics that you shared earlier, DC has such a wealth gap, but that wealth gap really hits on racial lines here in Washington, DC. And so when I think about, a lot of what I've been thinking about in the last couple of months is, oh no, we're about to have a lot more people who need food, medical, social services, legal, all of the stuff that Bread for the City provides. And they're adding on top of communities that have been historically disinvested in and marginalized and unsupported. And so how do we now use this moment to build that political will and that solidarity with our local government to say, not only should you be helping these folks who had these historically stable middle-class jobs and who are now really been thrown for a loop. I don't want to not help those people, but I also want to think, how can we really help foundationally the people who have already for so long been in need of that extra political support, policies that would help economically. So we know that the healthiest areas are the ones that are the best resourced. We know that health outcomes in DC have not really budged since people started moving in the 60s and 70s around these campaigns, the poor people's campaigns and things like that. They haven't budged because that economic reality is still there. People who are still the poorest in our area still have the worst health outcomes. People who are the wealthiest in our area still have the highest health outcomes or the best health outcomes. And we can't ignore the fact that that's cut on racial lines. So I do think that the local government should be stepping up and thinking of ways that they can be helping people who are impacted by the current federal policies, especially in the economic area, when we're going to see this widespread economic devastation to our region because of the federal workforce. But I think we should be mindful in those policies of how can we make sure that any change in local policy to support those groups are keeping in mind everybody who is already historically been marginalized and unsupported. So how can rising seas lift all boats? How does that look for our region? Any final thoughts either about what I just said, any reactions to that, or just final thoughts on the topic today before we wrap up?
I guess a final thought for me, just based on what you were just saying, a final couple of thoughts is one, I do wonder if there's an opportunity right now to try and engage folks, federal workers who live in DC and who may not always be paying a lot of attention to what's happening in local policy making, but who um, likely would care. Is this an opportunity to try and, engage those folks more aggressively in what kinds of decisions are being made here, and in helping to make the case in a moment like this for um, greater resourcing of, our safety net of the kinds of programs that create a solid floor, so that we don't have people falling through the cracks. So I would offer up to folks that, like, if some of those folks, and I feel like all of us know somebody who's been laid off, like maybe this isn't time to engage them around what's happening also locally, and to try and have an impact there. Um, and I do think, what we do locally is going to matter a lot for how we come out of this moment. So this, maybe it's 2 years, maybe it's 4 years that we're, sort of facing these doomsday scenarios, but how do we make it to the other side intact so that we can kind of do the rebuilding we're going to need to do when we get there? And I think that has a lot to do with the budget choices that we make this year and the next couple of years. And also has a lot to do with kind of how we're able to engage people around the really important role that government plays in resourcing our communities and, in our ability to thrive here in the district.
Thank you so much. Allison, turning it to you, any final thoughts this afternoon?
No, just thank you all for coming out here and spread this. Don't spread panic among people. Super important. We don't know what's going to happen yet. We just don't know what's going to happen for people's benefits. But we're here. We have capacity to take on cases for people. If something happens to people's benefits and there's anything we can do, you can feel free to refer them to Bread for the City.
Thank you. And again, thank you everyone for being here with us today. I will always plug donating to your local organizations like Bread for the City, like DC Fiscal Policy Institute. We can only provide these services, advocate for these services if we are here. You probably know that a lot of nonprofits and charities in the whole of the United States are feeling very threatened right now in terms of our ability to carry on. So for those who are doing well during this time, being able to dig a little deeper, donate. If you're interested in finding out how to get involved at Bread for the City, you can reach out to myself, Chioma Iwoha, Tong Kim, members of our team who invited you to this, for instance. We're going to be including in our follow-up materials ways that you can also get engaged with the DC Fiscal Policy Institute, including being on their newsletter. I get their newsletter. It really is fantastic because you get all of their articles and studies and reports pushed right to your inbox. It keeps you really up to date on what's happening and also the calculations that they're doing about how certain policies are going to impact people. Sign up for Bread for the City's newsletter. Follow us on social media because you're going to get some real up-to-date things on what's happening. I did see some comments in the chat about being able to have scripts or call lists if you want to advocate for local or federal policies. We do share that type of thing on our social media, and so follow along. Thank you again all for being here. You will get follow-up materials from us, and I just appreciate you spending your lunch hour with us as we talk through this really important topic. So thank you so much.